Hi, everybody. My name is Emily. I'm one of the diabetes educators here at Children's Minnesota, and this is our initial education video series. This series is for people who have recently been diagnosed with diabetes or have recently started on insulin therapy. So come one, come all, let's get started and get learning. I'm going to pull up my PowerPoint so that you can see my screen. And here we go. Alrighty, so this is video one in our initial education video series, Understanding Diabetes. So the purpose of our initial education video series is to really build upon the skills and knowledge that you gained while you were in the hospital after being diagnosed with diabetes. In the hospital, you learned how to check blood sugars, give insulin, what to do if you're low. And these are our very basic survival skills that we need in order to live safely with diabetes. These initial education videos are going to help us better understand diabetes, how we treat it, and how we fit this into our lives. So we're just really doing a big old deep dive in learning how to manage diabetes effectively in our lives. Our initial education video series does contain 5 videos. This is video 1, Understanding Diabetes. After this is video 2, Understanding Insulin. Video 3 is about hypoglycemia. Video 4 is about ketones and sick day management. And video 5 is resources and additional information. Now, as we are going through this information in these videos, you may find that some of this is review, and that's okay. We want to review some of these core topics so that you can really get them ingrained in your body and in your mind, because diabetes is really important to understand so that we can manage it effectively. So our diabetes team here at Children's is comprised of multiple different healthcare professionals. We have our pediatric endocrinologists. They're our medical doctors. You would have met one of these people in the hospital when you were diagnosed. We also have our pediatric advanced practice providers, and they are our nurse practitioners or NPs and our physician's assistants or PAs. Our advanced practice providers are really integral in our diabetes team. This is who you're going to be following up with very closely in this first year after your diagnosis, as well as throughout your life with diabetes here at Children's. We also have our certified diabetes care and education specialists. We call ourselves diabetes educators, much quicker and easier to say, but we are both registered nurses and registered dietitians, and then we are credentialed as a CDCES. We also have our registered dietitians or our RDs, and they specialize in nutrition and the dietary component of diabetes. So if you're having any issues with carb counting, meal planning, balancing out meals, anything like that, our dietitians are here to help you. We also have social work here at Children's, and social work is here to help you if you're having any issues with finances, housing, transportation, access to food, any of those things. Social work is here to help. So please reach out to us and let us know if social work is needed to assist you better. We also have our psychology team, and our psychology team is a really important part of our diabetes team. Diabetes is a chronic disease and it's 24/7, and we love to have our patients work with psychology to learn how to manage this chronic disease and the burdens that it can have in our lives. So please, please, please reach out, ask us to connect you with our psychology team. If you're having any feelings of burnout, if you're feeling any sort of negativity towards diabetes, please reach out so we can connect you with our diabetes psychologists. After diagnosis, it's also very common to go through the stages of grief because we're grieving the normal way of life that we've been living. And this is another reason to get connected with our psychology team. So again, please let us know if you would like us to get you connected with our psychology team, and we will make that connection. We also have our child life specialists in our diabetes team. You would have met one of our child life specialists in the hospital, and they really specialize in communicating with children and adolescents. So, in the outpatient setting, if you are changing your diabetes plan, starting new technology, anything like that, and you would like help communicating that with your child, please reach out and we can have our child life specialists meet with you to introduce the new plan or the new technology. Now, Initial Education, this video series is the first step in our Journey to Success program. Our Journey to Success program is a series of educational topics that we visit at each of your appointments in this first year after diagnosis. There's a lot to learn about diabetes, so we want to break it up into little nuggets of information to help you digest and keep that information so that you can survive and thrive with diabetes. So here you can see the different follow-ups that you're going to be having. They are frequent, we know. We're aware of that. And then the associated educational topics that we will be covering at those appointments. There is going to be some repeat and review, and again, that is just to make sure that these topics and this knowledge is really ingrained and embodied in you. Because these are such frequent follow-ups, we do allow you to do a combination of in-clinic and virtual visits to help fit this into your lives a little bit better. And you can see in this key here that the follow-up visits highlighted in purple are in-clinic visits, and then the blue ones are virtual visits. Essentially, we do want to lay eyes on your child physically in person about every 3 months, and then those visits in between can be virtual visits. Okay, so now let's better understand diabetes. What is diabetes? So, diabetes is a chronic disease characterized by elevated glucose levels in the body. The medical term diabetes mellitus, the Latin term for sweet urine. Now, this goes back to way before today's technology, and how you used to be diagnosed with diabetes was by a doctor sampling your urine. And these elevated glucose levels get excreted through the urine, and so your urine becomes sweet. Now, we've become much more advanced since then, but that is the origin of the term. So, diabetes mellitus means sweet urine. Diabetes in general affects about 35% of the US population. And within that 35%, there are two major types of diabetes. There are some other subtypes, but our two major ones are what we're going to be focusing on today. So type 1 and type 2 are the two major types, and the difference between them is what type of disease they are. What is causing the elevated glucose levels in the body? So type 1 diabetes is an autoimmune disease. Type 1 diabetes affects about 5 to 10% of people with diabetes, so it's much more rare. And it does affect about 1 in 300 children. So if your kid goes to kind of a bigger school, it's likely that there's another kid in their class that also has diabetes. It's nice to meet other people with diabetes. You can always reach out to your health office at school and see if you can get connected with those other families. Now, type 1 diabetes, it's this autoimmune disease, and it's characterized by an autoimmune process in which the beta cells of the pancreas are destroyed, and it leads to absolute insulin deficiency. Because no insulin is being made, the body requires insulin replacement therapy through insulin injections. So for type 1 diabetes, insulin injections are always required in order to continue living with diabetes. Type 2 diabetes is that other major type of diabetes, and it's much more common. It is a metabolic disease, which means that your body's metabolizing glucose and insulin incorrectly, or not efficiently, really. So type 2 diabetes is much more common. It is about 90% of the diabetes cases in the US, so you hear about it a lot more frequently. Type 2 diabetes is really characterized by insulin resistance. So that means that your body is probably still making insulin, but it's not doing its job effectively. Your body's resistant to the insulin it's making. Because of this, there is a potential for this disease to be managed with lifestyle changes and oral medications. But oftentimes, children do require insulin replacement therapy as well. Their body just needs that extra assistance to create more insulin so that they can function, their body can function appropriately. All right, so those are the major two types of diabetes. Now, let's really hone in on what's happening inside the body for everybody with diabetes. So, we need to understand what our pancreas is. Our pancreas is a digestive organ. It sits in our abdomen right by our stomach, and its job is to regulate our blood glucose level by producing two different hormones. The two hormones are insulin and glucagon. So that first hormone is insulin. It's made by the beta cells of the pancreas, and its job is to decrease blood sugar. The second hormone is glucagon. It is made by the alpha cells of the pancreas, and its job is to increase blood sugar. So in somebody who has a functioning pancreas, their body's automatically creating and secreting insulin and glucose to keep our blood sugar level super steady throughout the day. Now, why is this important? Well, as humans, glucose is our primary source of energy. We need to have glucose to function, to run throughout the day, to have our bodies run effectively. Now, glucose we get from two different major sources. The first source is the food we eat, primarily carbohydrates, and the stored glucose in our liver and muscles. So this image on the right side of the screen is kind of an image of what's happening in our body when glucose is created and secreted into the bloodstream. So the red little line through the middle, that is supposed to be our bloodstream. On the left, you can see our muscles and our liver, and there are green G's coming out of them. Those green G's are glucose molecules or sugar molecules. Those are getting released into the blood, and then on the right side, you can see this kind of orange-brown square, and that is a cell in the body. Our body is created full of cells. We have skin cells, fat cells, hair cells, muscle cells. All of these cells require glucose for energy so that they can function appropriately. So glucose, as it's released from the muscles and liver, and when it's brought into the bloodstream from the food that we eat, that glucose enters into the bloodstream and then it has to get inside of those cells to be used for energy. And a key aspect of this is that these cells all have receptor doorways on them, and those doors can open and shut. The doors have to be open for that glucose to get inside. So that is a key concept to remember. We have receptor doors, and those doors have to be open to get glucose inside for energy. Now, let's talk really quickly about blood glucose level. What does that mean? So in this image, you can see those green G's inside that bloodstream. And when we're talking about blood sugar level, when you're checking a blood sugar with your finger, it's measuring the actual number of glucose molecules in the blood at that time. And that number can fluctuate throughout the day depending on when we're eating and how much glucose is being released from our liver and muscles. So now the image on the bottom left here with the yellow background, this is showing us how our glucose levels fluctuate throughout the day. And this is somebody with or without diabetes. Everybody's glucose levels fluctuate throughout the day. So the red line through the middle of that image is our blood glucose level. And you can see that this person ate some carbohydrates, they ate some bread, that got broken down into glucose molecules and they were released into the bloodstream, which raised the blood sugar. The glucose left the bloodstream, must have gone into the cells, and so that blood glucose level fell. And then the muscles and the liver released a little bit of glucose in the background to boost that blood sugar so our body still had energy to function. And that's that major purpose of the liver and muscles, is to give us glucose in the background. It's so that when we're fasting and in between meals, we still have energy to function. Okay, so what does insulin have to do with this? So insulin is the key to glucose utilization. So insulin truly acts like a key to those receptor doorways. Remember I told you to keep that in mind, those receptor doors? So insulin physically unopens those doorways. It opens them up so that glucose can enter inside to be used for energy. And without insulin, those doorways are shut and glucose cannot get inside. Our body just can't function appropriately without it. Now, in somebody with a functioning pancreas, their pancreas is automatically secreting insulin in tandem with blood sugars rising and falling. So you can see in this bottom left image, very similar to the one on the previous page, that this person ate some carbohydrates and their blood sugar level rose. The blue line on top of that is insulin level. And you can see that for this person, as their blood sugar was rising, their insulin level increased. That pancreas knew what to do, and it put out some more insulin to handle that glucose. And then as that blood sugar level was falling, the insulin level fell. The body didn't need as much insulin. And so you can see with somebody without diabetes, with a functioning pancreas, their body's automatically secreting just the right amount of insulin to accommodate that blood sugar level as it rises and falls. And it rises and falls in the same pattern as that glucose level. Whoop. I don't need a laser pointer. There we go. So what happens if you don't have enough insulin? What if I have diabetes? My body doesn't make enough, or that insulin's not doing its job? Well, the cells, as you can see on the right side of this image, those doorways are shut. Glucose cannot get inside, and so these cells are losing energy. They're getting shriveled up, they're fatigued, they can't function well, they're losing weight. Those are all symptoms of diabetes. So as this glucose level is rising and rising and rising in the bloodstream, there's just no way for the body to use it for energy without that insulin. And when the glucose levels are raised like this is called hyperglycemia. Hyperglycemia very basically means high blood sugar, excess blood sugar in the blood, sugar in the blood. So a way to remember this is hyper. So think of like a hyper dog or a hyper toddler. They have lots and lots of energy. And in somebody with hyperglycemia, they have lots and lots of glucose in the blood. When we have persistent hyperglycemia, which is happening for people with undiagnosed diabetes, that's when we get all of these symptoms of losing weight, we're thirsty, we're hungry, we're peeing a bunch, and that's when we're usually diagnosed with diabetes, once we're pretty symptomatic like that. Okay, so let's try to understand autoimmune disease a little bit further. And again, this is type 1 diabetes. So autoimmune disease, what is it? It is when our own body's infection-fighting system, our immune system, starts attacking itself. And in type 1 diabetes, it's the beta cells that are being recognized as foreign and destroyed by our immune system. This process of destruction can take anywhere from a couple weeks to many months, and it's different for every single person. Now, for type 1 diabetes, there is a genetic predisposition to it, and so you can see it kind of falling into a family line as that gene gets passed on. But it's very important to recognize that it is there is a genetic aspect to it, because this is something that was just meant to happen in your life. So if you have that genetic predisposition, you may find that there was a trigger event that activated that autoimmune process. And this trigger event can really be any sort of stressful event to the body. So it could be illness, it could be an injury, it could be increased stress level. And some people can look back and say, yep, I had a really bad broken arm about 2 months before my diagnosis. Right after that broken arm is when I started getting hungry and thirsty and peeing a lot. Some people look back, they can't identify a trigger event, and that's okay, but some people can. Now, when we're diagnosed, we usually have about 15 to 20% of our beta cells remaining, and we'll talk about that a little bit more on the next slide. But so with type 1 diabetes, it does have that genetic predisposition, and I do want you to really absorb that because due to that, there's nothing you can do to have prevented this from happening. And we also can't stop this autoimmune process once it has started. So I want you to release any sort of shame or blame that you feel with this diagnosis. It was just meant to happen. And so at this point, we just need to learn how to manage diabetes and bring diabetes with us through this journey called life. Okay, so let's quickly talk about our honeymoon phase. Our honeymoon phase is a period of time when those remaining 15 to 20% of beta cells perk up and start producing insulin again. Now, when we're diagnosed with diabetes, type 1 specifically in this case, usually we're diagnosed when about 15 to 20% of those beta cells are remaining. And at diagnosis, those remaining beta cells are kind of in hibernation. They're like, oh, it's toxic environment out there. I can't do my job. And then once we introduce injected insulin and those blood sugar levels start coming down, it's a little bit more of a favorable environment. And so those remaining beta cells perk up and say, I can try doing this again. And your body starts producing a little bit of insulin. This is what we call our honeymoon phase because our body's doing a little bit of work, which is kind of nice. So during the honeymoon phase, you will find that your insulin needs typically decrease. So doses need to be decreased to accommodate the fact that your body's creating a little bit of insulin. This is characterized mostly by lower blood sugars. If you start having some lows, you might be entering into your honeymoon phase, and we just want you to be in communication with our clinic. Now, eventually, those remaining beta cells will be destroyed. And at that point, your honeymoon phase has ended, and our insulin needs will increase again. You'll start seeing blood sugars rising a little bit. They're a little bit harder to manage, and that again signals the end of the honeymoon phase and that we need more injectable insulin. Now, not everybody is going to have a honeymoon phase, but some people do. So we want you to be aware of it if you start noticing those lower blood sugars. And then please just be in contact with us so that we can help you make dose changes. We're going to touch more on this at your week 2 education as well. So if you do have more questions about it, know that we will be circling back to the topic. All right, so this concludes video 1, Understanding Diabetes. Up next, we have Understanding Insulin. I'll see you there. Bye.